Hey guys! So, I'm Decaying Jinx, and I'm back at it again with another video that has nothing to do with anything. I'm a nursing student. This is my friend Kat. She is a pre-law student. We were recording for like 15-20 fucking minutes and did not actually record anything. So let's continue with what we were doing, watching Chicago Med. As I was just saying, like right now, she's actually just about to do a intramuscular injection. Markings for that is 2 to 3 fingers down. I do 3 fingers, 2 to 3, and then on like it depends on the size of your patient and things like that. And then you wanna hold like that and squeeze the muscle just a little, just so that you can elevate the skin, elevate and tell whether you're going into the subcutaneous or into the intramuscular area. And you just put it in, you push it through, and you pull it out. Apparently in the old days you used to aspirate the needle, like when you put it in, and then you aspirate just to like check if you are hitting a vein or not. That's apparently no longer best practice. So yeah, that's why we don't see Rachel doing that. So yeah, let's go back to the tab.
All right.
Let's do this
You
right.
shouldn't be giving away your boots, particularly in January.
No, I'll manage. I always do.
How did you manage last week after you gave away your gloves?
Frostbites all heal.
You're too much. All right, soak your feet.
Yeah.
I'll be back to check on you.
Okay.
So she's warming up. Holy fuck. She's just warming up his feet at the moment so that they're capable of giving proper treatment to his feet.
That excuse is so lame, it needs crutches.
You have
Roger,
to use
I put in that order hours ago. No, I will not hold. Roger? Raj? Oh. Only after that I would go downstairs and ream Roger's ass. But not today. I'm in too good a mood.
And why is that?
Christy Pierce.
Oh, yeah, today's a big day.
Uh-huh. Christy Pierce?
Yeah, a teen with aplastic anemia, been in and out of med the last 10 years due to infections, but finally today she's getting a bone marrow transplant.
It hasn't been 10 years.
Yes, it has. I know, because I was sitting in your chair the first time her mother brought her here.
You think I'm tough? You should have seen her.
I'm going up to say hello.
Give Christy a kiss for me.
So Dr. Farinas has told me that a transplant isn't painful. You'll be awake the whole time.
It's a simple process. We'll administer the donor stem cells through your central line.
curious.
It's like a blood transfusion.
Really happening. Finally.
Well, we just heard from the clinic in Springfield. The bags are en route.
Oh my god.
Mom, you promised.
Fusion.
Is it
I'm just curious by the doctor. Just when he's because like it's gown, mask, gloves. What? Jesus fucking Christ! It's gown, mask, goggles, gloves. In that order, that is how you put on your PPE: gown, mask, goggles, gloves. And you like wash your hands first, obviously, before you put on your PPE. It's just interesting to me. I'm like, did he like wipe down his stethoscope, then wash his hands, then put on his gown, then put on his stethoscope? Also, none of them are wearing goggles, but like that, the reason why they're not wearing goggles is probably because
It's not that.
it's not like you can't give someone an infection from your eyes unless you're like directly like touching the eye.
Yeah.
It's more so it protects the person that's wearing the goggles.
really happening? Finally.
Well, we just heard from the clinic in Springfield. The bags are en route.
Oh my god.
Mom, you promised. No crying.
I'm sorry. I can't help it.
And Nick, I can't believe you. You're almost as tall as me.
He has been a very busy little brother. He's got all his friends together and they've been shoveling driveways to raise money. Oh, show Miss Goodwin the flyer.
I want to be Miss Goodwin or a surgeon.
We're gonna send Christy's donor and her family on a vacation.
They've already raised $1,000.
It's a sweet gesture.
He's just trying to build up his muscles to impress the girls.
Hey, I'm not.
Well, I'll leave you in good hands with Dr. Farinas. I'll check back later.
Oh, I've never seen Mom. That's
Dr. Rhodes, pretty slick in the OR.
I want to be her, but not a general surgeon.
This is a very fast lumpectomy for a fellow. Had to be under 30 seconds. Would you pick that?
I want to be either cardiothoracic, neuro, or trauma. Trauma. Trauma is probably my number one. Then cardio, then neuro. It used to be neuro first, but
Rhodes, Dr. Rhodes, don't.
Oh my God, yeah.
That up?
Riyadh. Oil workers
Elevator.
abdominal injuries on the derricks.
Put the elevator. Ah.
Wow.
Always in the elevator.
You okay?
Yes, I just banged it on the shower in Orlando.
Let me take a look.
No,
at
no,
it.
no. It's
No,
fine.
no, just, hey, shush, shush. Just shh.
Wait. Oh, no, no, no. What are we doing?
No, you are going to ortho to get that checked
No,
out.
it's not necessary.
Your elbow is red and it feels hot. So yeah, it is.
Yeah, well, I put myself on Cipro, so.
Oh, so you know you have an infection.
Just as a precaution.
Well, as a precaution, you are going to get it checked out because that may need to be trained. Look, Sam, this is serious.
He cares for you.
You know better. Don't mess around.
Okay, all right.
Sweet, yeah.
I will get it looked
He
at.
cares for her.
Okay.
Cipro is like an antibiotic, and it's a prophylactic antibiotic. Prophylaxis means you're like trying to prevent, and then it's like you would take the antibiotic to prevent getting the infection. Generally, like people get prophylactic antibiotics after surgery when they are assuming that they're immunocompromised and they're going to be into an area where they are likely to be in contact with certain bacteria and things like that. That's why she gave herself Cipro, because she's like, oh, this could be an infection. I'm going to take Cipro.
She stole it from the hospital.
She probably got another doctor to prescribe it for her, because you can't prescribe yourself medications.
That's why I said, I'm like, did she steal?
Yeah.
Did she rob the hospital?
There's actually like this cool fucking, like, you can't just like, in like most hospitals, there's something in Ontario at least, there's something called Omnicell. And it's like this giant fucking machine. It is the coolest thing. You have to like type it, like you have to like either swipe your badge number, check, like it's different depending on facility to facility, but like literally straight up pharmacy will send up, like you put in the prescription into the machine, and then as you like try to go to dispense medication, it's like literally impossible. Not impossible, because mistakes happen, double doses happen. It's just to like, it's pretty much impossible to steal medication is what it is. It's pretty much impossible to steal medication
without being caught.
Yeah.
You could steal,
yeah,
but you would get caught.
Yeah.
Because you were the last person.
Yeah. And Omnicell has cameras. Omnicell has I was gonna say pictures, but if it has cameras, fucking duh. But yeah, it's like super cool. Anyways, sorry.
Ask him.
Way into the machine.
Yeah.
Ouch.
You were right. Two bone distal fracture, moderately displaced. It needs to be plated.
Wait till I'm her.
Diagnostic genius. Not with that degree of deformity. Mr. Blevins.
I'm done here. Let him take me away.
Well, I'm afraid first you need surgery to realign the bones in your arm. We're gonna have an orthopedic surgeon come down right now
No surgery.
Oh, psychiatry.
Well, without it, your arm may not heal properly. You could have a permanent deformity and reduced function.
Put a cast on it.
Mr. Blevins, you want some water?
No, what I want is to be taken out of here. Put the cuffs Put the cuffs on.
Mr. Button. Okay. All right, I need suction. Get a crash car and have atropine ready in case his heart rate drops. We are not losing this guy.
Okay. I'm just gonna let it play for a second.
Where is he? Where is Walter?
We're running a few tests right now. When he's done, I can take you to him. Dr. Halstead, this is Ms. Blevins.
Please, someone tell me what's going on.
Your husband was in a car accident. He has a badly broken arm, and in the last half hour, he began coughing up blood and passed out.
Oh my God.
Is Walter being treated for any illnesses?
No, he's fine. I need to see him.
Okay. I can take you to his room.
Excuse me, Mrs. Blevins? My name's Jay Halstead. I'm a detective with the Chicago Police Department. I need to ask you a few questions about your husband.
Why are the police involved? I thought Walter was in an accident.
Yes, he was driving a car that he stole at gunpoint.
What?
There's multiple witnesses.
That son of a bitch.
I'm sorry, ma'am.
My husband is no angel. I knew that when I married him, but he has been straight for 18 years. Has a job, a kid, and now out of the blue, he throws it all away? I warned him if he ever committed another crime, I would leave him, and that is exactly what I'm going to do. What do you want to know?
Why don't we go sit down somewhere? Yeah.
Okay, that is just heartbreaking. Absolutely heartbreaking. And like also lots of people like are like, why do the cops just like straight like get into the situation before they can even see the family member or things like that? It's just because the fresher the information and before you can even like get to talk to somebody else to like mess up that information, they want to hear the freshest of what you got. So right here, context, I feel like the cops are doing, like, as shitty as it is, like the cops are definitely doing their fucking job.
I'm looking for a Robert Parker.
Bobby's in treatment 3. But who called for a psych consult?
The attending, Dr. Movat. Why?
I know Bobby. Treated him for a month now. He's just really kind.
Huh. I guess there's some concern that he can't take care of himself.
Because he gave some clothes away? He just likes to help people.
I'm glad. I'm actually very glad. I'm very glad that they got a psych consult because, like, that is like a sign. Like, it's very worrying. Self-preservation is a thing.
He is basically life shit. He's done with life, but he's trying to
go by helping people out.
Yeah. And he's like, okay, if I give my shoes away, maybe I'll freeze and not wake up.
That's one thought. Yeah. I don't know. I'm excited.
He is such a good nurser.
Is she gonna?
It took Jeff 3 or 4 days to actually get the hang of it.
So beautiful.
I was gonna ask.
Look at this.
Hey, where is she?
I hate
Couldn't resist.
her.
Oh, something for him to wear on the way home.
Mother-in-law.
Oh, I think he's finished. Oh, you think he is? I'll get him. You come here. You come here to me.
No, my parents emailed. They should be here soon.
Oh. Well, they'll be so happy to see the baby. They must miss you terribly.
Yeah, they complain about it all the time. Always asking when I'm going to move back to Seattle.
Do you ever think about that?
Oh, yeah. But I want to finish my fellowship.
I completely get where you're coming from, Mama Bear. Your son is gone, taken from you so horribly, so young. A mother should never have to survive their children. That's just what it is. But
Also,
it happens.
He's an adult.
Yeah, she's an adult. It's life. It happens. And she's going to want to move back to her family. You are probably going to make a constant reminder of the fact that, oh, this, like, especially being in the town where she met Jeff, where she met the man of her dreams who died. Yeah, she's probably going to want to go back home, raise the kid with the village of her family. What you could do is move with them, visit, or communicate your feelings and get told fuck off.
Well, you met Jeff here. You must have a lot of good memories here.
Of course I do.
I mean, I know the weather's not good in Chicago, but Seattle, oh, that rain. I get depressed.
So, how long you been living at the shelter, Bobby?
About 2 months now.
And where were you before that?
At home, Lincoln Park.
Oh, nice neighborhood. Shelter must have been quite a change.
I don't mind. The people there need me. I don't have much anymore, but what I do have, I'm happy to give.
And what prompted?
We were playing a stupid game called Jackbox. Love Jackbox. It fucking asked us the question, which parks are in where? And Lincoln Park, I think in New York, and Lincoln Park popped up, and I was like, that sounds familiar. Click. No. It's fucking Chicago, apparently.
You to make the move from Lincoln Park.
It's my wife's idea. She said I was giving away all of our savings, bankrupting the family. She didn't know what happened to me, why I changed.
Tell me how you changed.
I used to be a regular guy. Corporate job, a house, a couple of cars. One morning I woke up and I realized that the only thing I wanted to do, the only thing that mattered, was helping other people.
Yeah.
Giving whatever I had to them.
Any idea of the source of this inspiration?
You mean, did God talk to me or an angel? No, I just knew.
I think this might be surgical.
Yeah. Something wrong with his brain.
Yeah.
I barely see it. It's the gray spot right here. That's the hematoma. We often see it in car crashes. When the seatbelt you're wearing tightened, it causes a deep bruising on your intestine.
The next morning.
So I'm like,
and
bleeding inside.
Not anymore. Blood's clotted now, forming a solid mass, causing the swelling and pain you're feeling in your stomach.
Yeah, I roll.
Swelling should go down in a couple of days. For the next few hours, we'll continue to monitor you. So sit tight, all right?
What about Jess?
She's still in ICU.
Met at this coffee shop. But it was too crowded. So I suggested we drive to one a few miles away. That's when it happened. Can I see her?
I'll have a nurse take you up to ICU once Jess has been cleared for visitors.
Thanks.
That would be my job. That would be my job. I'm not a nurse. Then the nurses would be too busy to actually do that. They wouldn't grab a porter. They wouldn't do anything like that. They would actually like if the nurse had time, the nurse would take her, would create time to then take him. But that would be my job. Nursing student, hi.
I take you anywhere you want to go.
Yeah.
Initial there, please. And sign here to acknowledge receipt. 2 bags HLA matched bone marrow regenerating stem cells for patient Christy Pierce.
Thank you.
Okay.
Careful.
As much as people shit on shit wiping, when people are very most people are very appreciative, and it's like a dignity. Like, people don't want their ass to be wiped by someone else. But the fact that their ass is getting wiped is nice. So be compassionate about it, and don't be rude to ass wipers. Yeah.
With these. Thanks. Fingers crossed.
Sharon. I'm sorry to have to tell you this, believe me.
Tell me what?
The hospital's decided to shut down Christy Pierce's transplant.
What?
You seen these?
Yeah, Christy's brother put them up. He organized a fundraiser.
For Christy's donor.
And the hospital is concerned about the appearance of an individual being compensated for donating an organ, which
violates federal law. I know that, but no one's being paid. The donor agreed months ago.
well, it still puts the hospital and its staff at risk for hefty fines, sanctions, I mean, even imprisonment.
It's a kid doing a good deed. He's a minor.
It doesn't matter. These flyers have put us in an impossible situation.
What about Christy's impossible situation?
Maggie.
Yeah.
And unfortunately,
Christy's
that would be
just
my
gone through 5 days.
even as much as I don't like doing it, it's like I'm always the one they send for bad news.
Yeah.
And it's like, I don't make it sound so harsh though.
Yeah.
It's like I walk in, I'm like, I'm sorry. It wasn't my choice, but we have to shut this down. And not pick a fight like that.
Yeah.
And if it was turning into a fight, I would just put the paper down. I'm just doing my job.
Yeah.
And then walk away.
Don't shoot the messenger.
No, don't shoot the messenger.
Days of chemotherapy and radiation.
You can tell
Her body has been ravaged
They're
in
not
preparation for this transplant. Without it, she will die.
And she knows good way.
It's out of my hands.
No, Peter, it's still in your hands. Find a way to fix this.
I will do my best, but the law does not give me a lot of room to maneuver on this. You need to look for another donor.
The law or the hospital? It's the hospital. When he said law, I was like, no. That was wrong.
Shit, why is this going? Okay.
That was totally wrong.
But that's where we're gonna end it for the day, guys. Now let me see if we can actually see how long we've been going. Oh, perfect. Now that makes sense.
Yeah. We've been probably sitting here for like about an hour.
Yeah, just trying to figure out how to set this shit up and whatever. But like, it's a reactor's first time. So like, next time I might be reacted to something else. Please, if you enjoyed this video, subscribe. If you want to see some of my other videos that are all pure chaos, go right ahead. I am doing my 3 month, 1 month, 3 months, still figuring it out. Y'all tell me. Go watch the video and figure it out. All right, guys. Love you.